communities. I want to remind everyone that this hearing is being recorded and broadcasted live on Comcast 8 and RCN 82. I have it on credible authority that people do watch these channels, so hello to everyone tuning in. Please silence your cell phones and other electronic devices. Following the scheduled portion of this hearing, we will take public testimony. If you would like to testify, please be sure to sign in and check off the box to testify. I want to welcome Commissioner Emily Shea from the Elderly Commission to discuss these grants. Today, the committee will discuss Docket 1375, message and order authorizing the City of Boston to accept and expend the amount of $1,257,011.60 in the form of a grant. Supportive services awarded by the U.S. Department of Health and Human Services passed through the Mass Executive Office of Elder Affairs to be administered by the Elderly Commission. The grant will fund a comprehensive and coordinated health and social service system which assists elders in maintaining independent living in their own community as long as desired. And Docket 1376, message and order authorizing the City of Boston to accept and expend a grant of $474,233.75 for the Area Plan Administration awarded by U.S. Department of Health and Human Services, passed through the Mass Executive Office of Elder Affairs to be administered by the Elderly Commission. The grant would fund administrative expenses of the Elderly Commission Area Agency on Aging. I hope what you have to share is more succinct and compelling than what I've just read, and not a tongue twister. I would now like to turn it over to Commissioner Shea for an overview of these grants and the programs they will support.
Sure. So thank you, Counselor. I'm really excited to be here today. As you said, we're Boston's Area Agency on Aging, or AAA, which means that these funds through the Older Americans Act come to us, and we are very proud to say back out into the community. So most of these funds are pass-through funds for us. For docket number 1375, for supportive services, we keep some money in-house, which primarily funds our community service advocates who are out providing benefits application assistance, information and referral, connecting seniors to resources that they need out in the community. And then we give out 30 community grants. We have 30 grantees with this funding. So I'm not going to go into all of the grantees, but a portion of the money is set aside as mandated by the state, and frankly very well deserved, for legal services. Legal services to support older adults who may be having their heat turned off or lights turned off or need assistance kind of navigating systems and getting legal support for them. We fund senior programming in Boston, so we try to fund things across all neighborhoods of the city, funding different programs that older adults can participate in, whether that's exercise programs, other recreation. Within those programs, we fund services like translation and interpretation. So a program may be helping an older adult kind of read their mail or communicate with people they need to communicate with. We do housing assistance with that funding, so some housing search and application assistance. And also some senior home repair. So it just is a real range of things we put out in RFP. We have a whole grant making process where providers can apply to be one of our grantees with this money. So a very kind of above board transparent process so that we make sure we're using the funds wisely and so that we can make sure they're going to meet the needs of the older population. Should I move on to the second one?
I just had a quick question before you advance forward. Could you just speak to, since these services that this grant would fund are so critical and in many ways also very creative. So, we love to see that to make sure we're meeting the continuum of elder experience in the city and to support folks in aging and community and remaining independent and connected, so important. But how do we ensure that that is true and equitably the case? So can you speak a little bit to the application of these grants and if they are targeted towards specific neighborhood or geography?
Yeah, sure. So what I can say is that we, as part of our grant making process, we do look to make sure that we are targeting, that we're able to provide service in all different areas of the city. So we have, when people apply for the grants from us, we have a whole kind of reading and screening tool so that we're grading all the grants, and we have multiple readers, so it's a whole process like that. But then we add kind of an extra layer into looking at that to look at our geographic distribution of grants so that we can make sure that seniors in all areas of the city are getting served. I'll add another little piece to that, which could potentially be more than you want to know. But we are responsible as the AAA for doing a needs assessment every 4 years, so understanding the needs of the community, particularly our lower income older adults. And also within that needs assessment, then we're crafting something called an area plan. And some of that then is used to kind of guide how we make decisions on grant making.
Great. And just contextually, out of just basic curiosity, I mean, I know the baby boomer population is booming, right?
Certainly.
And it's why the city is so committed to making sure that we are aging well, since people are, thank God, living much longer. I'm just curious, does our elder population live in one community more than another? We anecdotally believe this is true, but I would just wanted to hear officially from you.
So what I would say is the last kind of official numbers I have for each neighborhood are based on 2010, and we have grown. We had about 88,000 older adults now. UMass then, and UMass estimates that in 2015 we had about 103,000, so we've grown substantially.
Wow.
That's for folks over the age of 60. But what I will say is West Roxbury has the highest percentage of older adults. So back in 2010, they were 24% people over 60. Dorchester obviously has the largest number of older adults just because it's our biggest neighborhood. But we do have those statistics available on our website. We did a data report that we have up on our website that where we looked at the 2010 census in collaboration with the UMass Gerontology Institute, their Center for Social and Demographic Research on Aging. And so we have a lot of great information on our website that kind of digs down even more into all of that.
Wonderful, Commissioner. You just confirmed anecdotally what I believe to be true with the two neighborhoods you cited. So, but just again, thank you for what you do every day for your service to the city and specifically for this population. You are, beloved by so many, and we're so glad you're still here. Did you want to speak about the other grant?
Sure, I will. But I will also just say I have a great team.
Yes, yes, I know that to be true as well.
Yes. So the second one, the docket 1376, this is for Title 3A of the Older Americans Act money, and that is administration. So this money is used to support our administration of the grant, salaries, fringe, office supplies, equipment. Definitely not as exciting as the other Title 3B, but really essential to being able to operate this correctly. And there are some other pieces of the Title III work that we'll be back here in January explaining to you that we're not talking about today. So there's other things we'll come back, but this A grant kind of is the administration of the full Title III spectrum of grants.
And what would be the impact if you were not, if these grants were not approved?
Oh my goodness, we do so much work through this money, and really about both the work we do here at the city, but also building a citywide aging network through this money. So I think the impact would be huge. we serve a significant number of older adults in the city with this funding. So
We don't want to think about it.
we don't want it to go away. It's federal dollars. We hope it will stay with us.
All right, very good. Any other testimony?
Nope.
Okay. All right, then. Is there any public testimony? All right. Well, I don't have any additional questions, so I want to thank you for your testimony, for being here today, and again, for what you and the entire team do for the city on behalf of, what is the most appropriate, tell me, we vacillate between senior, elder,
Sure.
older American,
So,
adult, what should we be
So
saying?
I think older adults, or I've actually recently heard a new term, older persons.
Wow, okay.
But I would say that all different segments of the population over the age of 60 like to be called all different things.
Okay,
So,
all right.
but older adult is good.
Okay, older adults. Okay, I prefer that too, personally. So, all right. Well, thank you for everything you're doing for the older adult population in the city, and I look forward to reporting this out to my colleagues tomorrow. All right,
Great.
we'll adjourn.
Thank you, Councilor.
Councilor.